Yes, I'm back.
Form of this agam?
Actually, it is a term which means inside, like the within. So that was how it was chosen, and it is also correlating with a global association of medicos. So it is just coincidental.
Okay.
Yeah.
Okay. It's great initiative.
Yes,
it's very nice.
Yeah, thank you. And so, yeah.
Because once you have the organization, then you get a platform to do the thing.
Indeed, ma'am, indeed.
Yes.
So can we go live now? Ram? Okay, has the stream started in YouTube? Okay. So all set, shall we begin now? Okay. So hello everyone. A very good evening to all the inquisitive young medicos of the country. And it gives me immense pleasure in welcoming you all today to Recherche Inquisitive, a pathway to your Icmr STS Success. Organized by Agam, and I'm Ridulaji, the president of Agam, and also the Icmr STS 2019 scholar. And joining with me today as the moderator, we have Sds Virvani, the state convener of Agam Gujarat, and the scholar of Icmr STS 2020. So hello, Shreyas.
Yeah, hi, Ridulagi.
Okay, so one of the greatest treasures of this planet, Albert Einstein once said, the true sign of intelligence is not knowledge, but imagination. And imagination is the highest form of research. So the scope of research in our country is on the growing trend for the past few decades. However, research still remains to be a rocket science for many people in the country. And the scenario is no different among the medicos of a country too. So revolutionizing this state of research, the Indian Council of Medical Research, as we all know, the Icmr, an esteemed organization of a country, started a program in the name of Icmr Short-Term Studentship, the Icmr STS, way back in 1979, to encourage the medical and dental students to engage themselves in learning this process of research at a very young age. So currently, this year, the Icmr STS portal is open to accept the proposals for the year 2022. And today, our event is all about that. So to give us an insight about this STS program and the process of registration and the basics of research, we have with us our two eminent speakers, Dr. Atul Rukadikar sir and Dr. Charushila Rukadikar ma'am from AIMS Gorakhpur. They are wonderful teachers who always show great interest in sharing their knowledge and expertise with the students in different fields, as specifically in research. Welcome, ma'am. Welcome, sir.
Thank you. Thank you, dear.
I now request Reyes to introduce our speakers to the audience.
Sure. Thank you so much, Ridulagi. So first of all, a very heartily welcome to Rukadikar sir, Atul Rukadikar sir, and Dr. Charushila ma'am. We are so glad to have you over here, and we are delighted to learn from you regarding Icmr. So our first speaker for the day, without further ado, we'll be beginning with the session. And the first session would be how to register for the Icmr. So the insights for the same would be provided by our first speaker for the day, Dr. Atul Rukadikar sir. So a bit about sir. Dr. Atul Rukadikar sir is currently working as an associate professor in the Department of Microbiology at All India Institute of Medical Sciences, Gorakhpur. He has done his graduation from Vaisapuram Government Medical College, Solapur, Maharashtra, and post-graduation in microbiology from Government Medical College, Nagpur. He was awarded distinction in microbiology by Maharashtra University of Health Sciences, Nasik, Maharashtra. He has worked as a faculty in Lokmanya Tilak Medical College and General Hospital, Mumbai, Chirayu Medical College, Bhopal, Zydus Medical College and Hospital, Dahod, Banas Medical College and Research Institute, Palanpur, Gujarat. He has also worked as a laboratory director and quality manager in NABL accredited molecular laboratory. He has been a member of various committees and recognized as an active member of various academic as well as extracurricular activities in this institute. He has contributed more than 40 publications in peer-reviewed journals and presented papers and posters at national and state conferences. His areas of interest are infection prevention control, laboratory quality management system, clinical microbiology, and medical education. He has undergone training in medical education, that is advanced course in medical education, certification course in hospital infection prevention and control, biomedical research by Icmr, and NABL internal auditors training course for NABL. So he is a very student friendly and always encourages the student for their development. We are so glad to have you here with us,
Thank you.
And over to you, sir, now.
Thank you, Shreyas. And first of all, I would like to thank you, the team Icmr and the members of the team Icmr who has given this opportunity to have a talk on this STS project. And with no time, I'll be starting my presentation. I'll be just screening you sharing you the screen. Just let me know. You are being able to host. Just one message has been coming. Host disabled participant screen sharing. So just a request for the member to just make me. Yeah, it's coming. I think.
Yes, sir, it's visible.
Okay. Is it visible now?
Yes,
is it
sir,
visible?
It is visible.
Okay. Okay, so with the no time, I'll be starting my presentation. So thank you once again for giving me the opportunity. And my topic will be just focusing on how you're going to register for Icmr STS project. So the main objectives will be why we need the STS project. क्या है ये क्यों करना चाहिए? So that is the first question which arises among the students. Why we need for the STS project? So that we are going to discuss in short. Then we will be seeing the various stages of the application process for getting registered for Icmr STS, which includes your 4 parts, part A, B, C, and D. Then which are the types of studies and the subject areas which are being given or laid down by the Icmr STS, in which you will be carrying out your research project. Then technical help in case of any error or any thing happens to you, and their take-home message. Okay. So first of all, why we require a STS research? Okay, so already we know that research is nothing but creating a new knowledge, creating a new ideas, new concept, and all these things. And with that intention, the Department of Health Research and the Icmr, that is Indian Council of Medical Research, in the year 1979 has initiated and come up with this STS project. And the main motive was just to promote the interest for the research among the medical undergraduates, to provide an opportunity to understand research methodology and the various techniques which are being pertaining to the research. And third, the incentive to take up the research as a career in the future prospect. Okay, but apart from that, what benefit which we are going to get from this STS research? So obviously we will be going, if our project is going to get selected in the Icmr, obviously we are going to have a 2R, that is a recognition and a respect from the colleagues, from the medical fraternity. So that is one of the advantage you can say which we are going to get from the STS research. We'll be having a scholarship that is of 50,000 rupees, which will be given after selection of our project by the Icmr. Additional benefits, you must be knowing some examination like USMLE and other foreign examinations, where the requirement is one of the project you have to carry out. So that is going to be beneficial when you will be applying for some foreign examinations and USMLE. Also, apart from that, all these things you will be able to know what actually or how you are going to do or you are going to conduct a research, and also to document it. So that is, I think, it is very, very important from student point of view, because at this level, you will be able to know how we are going to conduct the research, what are the things we have to include in the research proposal and all. Apart from it, you can also conduct more researches for getting published in the scientific journals. By doing all this thing, obviously, indirectly, you will be upgrading your CV just by adding all this research in your CV. You will be invited as a speaker in different conferences for this delivering this talk, and you will be a member of different institutions where later proves to be an additional recognition. So that is somewhat, you can say, lucrative, which you are going to get when you are going to perform or when you'll be involving in the STS research thing. Now, with this, during this last 37 years, the medical dental undergraduate students of various MCA, DCA recognized medical or dental colleges in the country, they have shown keen interest in this Icmr STS program. And for that purpose, the Icmr has decided to continue with this program by awarding limited number of studentships to deserving students, that is MBBS, BDS students, for the year 2022 also. And for this year, approximately 1,500 students, that is 1,200 from the MBBS fraternity and 300 from the BBS dental fraternity, will be awarded STS after report submission and the review for the year 2022. So if you see, the project has been initiated in the year 1979. And who will be the eligible candidates? That they are students, obviously the MBBS and the dental students, from first year to fourth year. They all are eligible for applying for the STS project, but the criteria that they should be before appearing in the fourth year final exam. But once the student is going to be appear in the final exam, he or she may not be eligible for registration also and for also submission of the research proposal. Okay, in this, if your project gets selected, will be given 25,000 per month for 2 months, because this is a duration which is being recommended by Icmr to carry out your research, and the grant has been increased from 10,000 to 25,000 per month. So for 2 months, it is coming out to be total 50,000. And it is meant to be a stipend for a student only after final selection of his or her STS report. So this we are going to receive only and only when our proposal and the report is being selected by the Icmr. Now, how we are going to apply for it? So application process mainly involves 2 parts. One is your part A, just you have to register it online. So that is the online registration. The registration has already been opened since 21st of January, and it is going to closed by 11th of February 2022 by 5 p.m. So just get it registered as early as possible. Part B will be giving you the guide details. Part C, the enclosures and the attachments which we have to attach during the research submission of the research proposal. And part D will be a research proposal submission. So part B, C, and D, they are supposed to be submitted by 21st of February 2020 by 5 p.m. But very important is to get it registered. So part B, C, and D, even they are not being now at this level, not being completed, but main, you go and register by 11th of February. Okay. So let us see regarding part A, that is the online registration, what it basically consists. So online registration mainly consists of three parts. One is your login details, course details, and the personal details. So in first login detail, what the things the student have to submit. So login detail, in that the student have to submit a complete email ID. So that is a mandatory requirement for getting registered for Icmr STS. Then mobile number has to be submitted. So email ID and mobile number are must in login detail. So अगर किसी का email ID नहीं है, so that person, he or her or she should be creating that email ID and get it registered. Email ID and mobile are to be registered in the login details. Second is the course detail, where the student course detail is to be filled up, which mainly includes the title, the first name, middle name, last name of the student, the date of joining a MBBS or a dental course, the day, month, and the year of the joining, then the college he or she belongs to, the class, whether MBBS or BDS, whether in the first professional, second professional, third professional, so that has to be filled. The name of the college in which the student is been studying, that has to be entered. The address, the city of that college, and the pin code of that college. So all these basically things which are being marked in the asterisks, they are supposed to be a mandatory filling. So they have to be filled. Okay. So in this course detail, these details has to be filled. Third is your personal details, where your gender, the nationality, the date of birth, the state or the home the student belongs to, the residential address, the city, pin code, if any alternate mobile number or a STD code, it has to be registered in this personal details. So online registration, it has a login details, course details, and personal details. So when all these three are being filled, there is a submit button. You have to just submit for the registration. Okay. So when you just click the submit button, you will be just receiving this acknowledgement from the Icmr that yes, dear Mr. XXS, you have been registered successfully for STS 2020. Okay. Apart from it, a message will be given that your login ID, password, and the reference ID will be sent to the email which you already have been filled in the login details. So these three are very, very important. They are going to receive to you on the mail ID which you have given in the login details. Okay. So this is just an acknowledgement when you submit the all registration process. So this completes with your online registration part. Now part B, part C and part D, which you have to fill till 21st of February by 5 p.m. So part B mainly concerns with the guide details under which you are going to carry out the research projects. So in this part B, you will be filling the name of the guide, full name of the guide, the designation of the guide under which you are going to carry out the project, the departmental name, the state or the college belongs to, the name of the college, then the address of the guide for the correspondence, the state, the city, pin code, the mobile number of the guide, and email ID of the guide. So these are some of the mandatory things as a part of a guide detail in part B you have to fill in. Remember, as per the guideline, only a regular full-time faculty member are allowed. No tutors, no demonstrators, no senior residents, no part-time faculty, no consultant, and no junior resident. So it is the only a full-time faculty which is mandatory to get registered for Icmr. Okay. Then the ratio should be 1:1. Okay. So there will be a one guide and one student. So 2 students with one guide will not be accepted. So ratio has been maintained in 1:1. Yes, they have permitted, the Icmr STS has permitted to keep a co-guide as such for carrying out the research proposal, but It is only the guide which will be carrying importance as far as the Icmr STS projects are concerned. Okay, so this completes with the Part B guide details. Part C mainly concerned with the enclosures and the attachments which has to be given at the time of research proposal submission. So this is a Part C, and the Part C mainly deals with the enclosures and the attachments which you have to fill in. Okay, very important. Just remember, in Part C, there is one form that is a application attestation form. So if you see on the right side, it is an application attestation form which has to be filled duly by the student and the guide, and it has to be uploaded when you are being putting your research proposal. Okay, so जब आप research proposal submit करोगे by 21st of February, this application attestation form duly filled is also mandatory to be submitted. Okay, so this application attestation form includes your reference ID, which you will be going to receive in your mail ID, the name of the student, the name of the guide, the name of the medical and the dental college, the title you are being or the project, the title of the project you are going to conduct, the photograph of the student. There is no need of attestation here, just you have to paste it. Then the date, then the certificate, it has to be signed by the guide, where you will be filling all your details. Then the signature of the guide is required. The details of the guide has to be filled here, the name, designation, and the department. And make sure, along with the guide, signature of the guide, you will have to take the signature of the head of the department and the head of the institution, whether a principal or a dean, with the block letters and the seal and the stamp. So that is a must requirement. Until and unless you fill with this, and if you, for example, if you are missed this stamp and just you have taken the signature, obviously your proposal is going to be rejected. So this is very, very important as far as proposal is being concerned. Okay, so signature of guide, signature of the head with stamp, signature of the head of the institution with stamp is mandatory. Okay. Second is your ethical committee approval, IEC or IAEC, if you have been involving any animal component in your research proposal, but this is not mandatory at this stage. Okay, so at the time of proposal submission, it is not mandatory. You just register, you just put your proposal along with application attestation form, and you can just get your ethical approval within 1 or 2 months after that. And this is being mandatory when you will be completing your report and when you will be submitting your report at that time. So in that case, this ethical committee approval is must. Okay, but for the time being now, for research proposal submission, it is not mandatory. Informed consent form, yes, if you are being involving any human participants, you have to take the informed consent, a case study form or a study questionnaire form. Jobbing your research is a questionnaire based and all these things. Make sure you have to submit all these details. Okay. As far as the guidelines are concerned, all this application attestation form, IEC, informed consent form, the case study form, and the study questionnaire, they have to be scanned in the PDF only, and the size is not be more than 1 MB. Okay, so no JPEG, no Word file is going to be accepted. It is the only PDF form which is going to get accepted, or that has to be uploaded. Okay, so this completes with your enclosure and the attachment. Part B, before that, how do I get this form, application attestation form? So just if you open the site, you'll be having on the left side application submission for STS 2022. You have to just click on this and you'll be getting a drop down menu. Okay, so in the download section, you'll be able to get this application attestation form. Okay, now IEC and IAC approval has to be taken. Already we have discussed, and it is necessary to obtain this before your actual research work, because until and unless you get an ethical approval, you will be not able to begin your research work. So it is just a thing that you just submit the research proposal to the ethical committee for the ethical clearance. Okay, the certificate may be submitted either along with the proposal or with the report. So already we have seen that it is not mandatory at the time of proposal, but yes, it is must when you are going to submit the report. The consent And the guidelines has to be taken from these things. So National Ethical Guidelines for Biomedical and Health Research on Human Participant 2017. So you can just go with this guideline as far as the clearance is being concerned. As discussed, all the documents should be in a PDF file, not more than 1 MB. No Word, JPG is going to be accepted. Part D research proposal. Part D mainly concerns with the research proposal, okay, that you are going to submit. So Part D, what are the things you have to fill in the Part D? So the title of your research, the type of the study. So the Icmr has given many of various studies and the subject areas which you can select, and you can just put there the name of the department under which you are going to conduct the study and the research proposal. Okay, so when you are going to make a research proposal, so these are the guidelines which you have to follow while making a research proposal. Like, it should be strictly in this order. Like, title of your project, that should be of 25 words, then introduction in 300 words, objectives in 100, methodology, it somewhat has to be a descriptive methodology, how you're going to carry out that project in 800 words, the implication, how it is going to help or how it will be a beneficial in 100 words, and the references. So various references are being there, but as per the Icmr, it has to be in a Banker style only. So when you are making a research proposal, make sure the sequence has to be followed. Okay, so this completes with your Part D. So these are various types of studies the Icmr STS has put on the website. So you can just select one of them, like clinical investigation, epidemiological investigation, field operation research, health education, lab investigation, etc. So these are the various types of studies, and these are the various subject areas. So if you see, almost every subject area from preclinical, paraclinical, and clinical branches, they are being given. So wherever your interest is there, you can just select the type of the study and the subject area in which you are going to carry out the research. But main thing you have to remember that when you are making a project and when you are going to submit the project, it should not have any identifying information of neither the guide or neither the student, for unbiased review by the reviewer. So when you are making a proposal, make sure you should not include the name of the student and the guide, the address, contact details, the telephone number, and email ID. So if by chance, if the name and all these things are being there, your project is going to be rejected. So it has to be extremely confidential as far as your proposals are concerned. Okay. So when you register with all these things, you will be getting this PDF, which will be including everything which you have entered. So registration detail in Part A, guide detail in Part B, attachment you have been given in Part C, and the proposed details in Part B. So these PDFs you will be getting when you will be submitting the research proposal along with the application attestation form. Okay. In case of any query, in case of any error, so the Icmr STS has given this email ID, that is stshre2017@gmail.com, and the various contact number of the authorized persons for dealing with the respective scientific queries, for the technical support, and for the administrative support. So these are the names of the authorized people with their extension number and also the contact number in case of you require any query or the technical help. Okay. So lastly, to take home message, already the online registration has been started. Do register by 11th of February 2022 by 5 p.m. Your Part B, C, and D, which mainly concerns with your proposal submission or the synopsis, it has to be submitted by 21st of February by 5 p.m. After 21st of February, it is going to be closed. Whatever the research proposals they are going to be in the Icmr, they are going to get evaluated at the Icmr, and the selected list of the proposal or the list of the selected candidates will be released by end of the April or the first week of the May 2022. after the selection, the candidate has to complete the project in any of the 2 given months. That is between your May to September 2022. 29th October 2022 by 5 p.m. is the last date for the report submission. So whatever the project you have made it has to be submitted by 29th of October 2022. After closing this submission form, all the projects will be evaluated by the Icmr, and among that, 1,500 students with approximately 1,200 from MBBS and 300 from BBS will be awarded STS award with the stipend and the certificate. Okay, so this is just a protocol which is being followed during this year Icmr SCS proposal or research projects. Okay, any registration, application, and the proposal submission or any such request will not be entertained at all by Icmr after the last date or the time is over. So make sure it has to be completed within the stipulated time or stipulated date. Okay, so this completes my talk regarding your registration and all these things. So thank you very much. Thank you once again.
Thank you so much, sir. That was very detailed insight on the stepwise registration process of this STS program this year. And especially thank you so much for throwing light on those important updates which has been given by Icmr this year, especially about those eligibility criteria which has changed this year. So definitely this session would have brought clarity in the minds of those students who were still in a confusion about the registration process. Thank you so much, sir.
Thank you.
So moving on to the next session.
Yeah, thank you so much, sir. That was beautifully explained, and I totally agree with Mutulagi. So coming on to our next speaker for the day, who would be throwing light on how to prepare a best synopsis out there. So our next speaker for the day is Dr. Charushila ma'am. We welcome you, ma'am. So brief about ma'am. So Dr. Charushila ma'am is currently working as an assistant professor in the Department of Physiology at All India Institute of Medical Sciences, Gorakhpur, Uttar Pradesh. She has completed her MBBS and MD Physiology from Government Medical College of Maharashtra. Afterwards, she worked as a faculty at Jai Medical College, Bhopal, Sds Medical College Hospital, Dahod, Banas Medical College and Research Institute, Palanpur, Gujarat. She was a member of various committees and recognized as an active member for various academic as well as extracurricular activities in this institute. She has received Best Faculty Award also. She has very much interest in research field. Her areas of interest are neuropsychiatry, sports physiology, ANS physiology. She has completed the courses like epidemiology and biostatistics, fundamentals at St. John's Research Institute, Bangalore, techniques of physiological science from Ainslie, exercise and sport physiology course from Physical Education of India, advanced biostatistics and research methodology also from Icmr. She is editorial board member for GJMS and Physiology Insight, which is a research bulletin of National Physiology Association of TV chapter. She has done many paper and poster presentations at various conferences and received the Best Paper and Poster Award too. She has more than 25 publications in peer-reviewed journals. She judged many events, scientific research paper, as well as poster presentation. She has guided students for Icmr STS, and her students received STS grants from Icmr too. Mainly, she is very much student-friendly and always encourages students for their development. We are truly delighted to have you here with us, ma'am. And after this introduction, I'm truly intriguing to know about how to write a synopsis from you. So over to you, ma'am.
Thank you, Shreyas, for these kind words. And thank you, Agam. I'm very much thankful to this organization for making this program, which is actually need of the time, because many students are confused. So it's a very good initiative that you guys have taken. And thank you so much for giving me this opportunity to talk on this topic, that how to prepare a research proposal. So without wasting the time, let's start with this discussion. So is my screen is visible?
Yes, ma'am, it's visible, ma'am.
Okay. So once again, thank you. And let's start with the how we are going to proceed for this talk. So already Dr. Atul sir has explained very nicely and in detail discussion on the application forms and the timelines has been explained. So my job is a little bit easy now. So I will go into the how you have to go for the topic selection, title, introduction, aims, objectives, methodology, implication, references, and what is the concept of this plagiarism, which you have to check before submitting your research proposal. So let's start one by one. So first thing, what do you mean by research? So there is one good quote which I like. That is, research means that you don't know, but you are willing to find it. And so in our daily routine also, we are searching something. So that searching, when you are converting into a proper methodology, then it becomes a research when you are created some new knowledge. Okay, so this is the process of creating new knowledge. Okay, and now this Icmr, as sir has discussed, and we all know that for the undergraduates, this is a very good opportunity because it is helpful not only for your PG studies, but it gives one experience. So sir has already mentioned that what are the benefits of the STS Icmr. Okay. Apart from this, I think that you're getting that experience to do the thing. That is also one more advantage of the contributing towards this STS research. So the part D, which you have to submit up to the 21st field. Okay. So how you are going to proceed? So let's start with this topic. Okay. So first of all, just open the Icmr website. There are the two links. One is the type of study, which is in front of your screen. Okay. So sir has enumerated the clinical investigation, epidemiological investigation, field operation research, health education research, lab investigation, product development, therapy and management. Okay. So just focus that what are these studies. So clinical investigation means when you are involving one or more than one human subject, and whatever the investigation that is to assess the safety, clinical performance, or effectiveness of the medical devices. Epidemiology, as the word suggests, it is related with the disease, whether it may be the cause, whether it may be the transmission, whether it may be the outbreak investigation, environmental epidemiology. So it is related with the disease. Okay. Field operations means you're going into field and then you're going to do the research regarding the management of the disease and how to solve the problem of the disease. Health education, nowadays, you know, all know that there are the COVID awareness programs or workshops. Okay, so like this, the things which can be lead to the health education, health awareness. So these topics also you can choose for the STS Icmr. There are the numerous lab investigations starting from basic CBC, BSL up to this COVID RT-PCR testing. Okay, so you can go for the any of this investigation. Regarding the healthcare product preparation, you can go for this. There can be the pharmacological therapies and non-pharmacological therapies. You can choose any of the therapies and then you can assess the results. Okay, but one thing you have to remember, that is there is a one concept, that is the clinical trials. Okay, and you all must know what is the clinical trial. That is involving the preparation of the new drug, new medical device, new vaccine, new surgical and medical treatments and procedures. But guys, as per the STS Icmr, you are not allowed to do this clinical trials under the STS Icmr project. Now the question is why? Because as an undergraduate, this will be your first, second, or third project, okay, of the research. Okay, considering this, the STS Icmr want that you get the experience and then go ahead. Okay, so clinical trials are not allowed. Coming towards the subject area, you can see from A to Z there are. For the dentist also, there are the oral health, pediatric dentistry, oral surgery. So there are the anatomy, physiology, biochemistry, then pharma, patho, then medicine, gynec, all are the topics. Apart from this, there are the lifestyle modification diseases, lifestyle diseases like the obesity. Then there can be the environmental, occupational health, Okay, so there are the numerous topics. Okay, but here, as your president also mentioned, that just use this quote, that is, the imagination is the highest form of research. So don't think within this box. Again, if you think something different topic, then also you can mention it. The ICMR has given the full freedom for this. Okay, so this research proposal, as we have seen the type of studies and the subject areas, now enlist the topic of your interest. Okay, make a list of almost there are the 50. If you can consider, the subject areas are almost 50, and they have mentioned the type of studies are almost 10 studies. Okay, so from this, just enlist the topic of your interest. Okay, so there can be the 10 topics. Okay, now with this list, meet your guide. Okay, now after meeting your guide, with this guidance of the guide and the knowledge which will you acquire by discussion with the your peers, or discussion with your teachers, or getting the information, narrow down your topics. Okay, now how to narrow down the topic? Okay, so now just let's see one example. Okay, and now this example is like the world is made up of the different countries, different states, different districts, different societies, different human beings. Okay, so if you can consider from the world, we are coming towards the human being. So it is just like a narrowing down. Okay, in the same way, whenever you are thinking about the research, first choose a broad area. Let's take an example of the obesity. So it's a broad area. Now in that broad area, if you can take up the effect on the different systems, now choose only one system from this. Okay, so in that one system, again, as we know that if we select this ANS, then it is made up of the sympathetic system and the parasympathetic system. Okay, now from that parasympathetic system, if you want to assess, then there are the different type of tests. So you can take the Valsalva maneuver, or you can take the cold pressure test. You can take any of the tests. Okay, for this. And now you have to decide in which you are going to do this. So you are going to do it on the students, patients, school-going children, or college-going adolescents. So whatever the sample you are going to test. Okay, after this, you can narrow down your topic as the effect of this Valsalva maneuver on the college-going obese students. Okay, so in this way, you are thinking about the obesity. Now you have assessed it with one test, Valsalva maneuver, that is related with your sympathetic and parasympathetic system, okay, which has the effect from the obesity. So in this way, the narrowing down is important. Okay, so this is just a common example. Okay, so in this way, so here are some selected ICMR topics, like the impact of social media on sleep, stress, and anxiety affecting the academic performance of the students. Okay, effect of the various phases of menstrual cycle on reaction time in the healthy female, the correlation of the body fat distribution with the iron profile, or the efficacy of the platelet-rich plasma in the treatment of bed sores. Okay, then decoding the human personality through the dermatography. Okay, so in this way, the things are first you have to make the broad idea and then narrow it down. Okay, now after you selected the topic, before finalizing it, just go through the research question and the hypothesis, which is the start point of the study. And here, there are the different terminology, both bade terms are jayenge. But what is the simple meaning? This is your start point of your study. Okay, so in this start point of study, there is a criteria which is called as a finer criteria. Okay, now finer criteria, F stand for feasible. सपोज करो आपने डिसाइड किया कोविड पे आप स्टडी करोगे, ठीक है, एंड अगर आप स्टडी करते हो मई और जून में, और आप तब तक सपोज कोविड के केसेस कम हो गए, देन विल यू गेट द सैंपल साइज? नो. So at that time, what you are going to, there should be any alternative. Okay, so in this way, whether it is feasible, second, whether you have that technical expertise. Suppose that आपने डिसाइड किया है एक इन्वेस्टिगेशन आप करोगे और आपके कॉलेज में वो इंस्ट्रूमेंट है ही नहीं, then so just see that whether it is possible in your setup. Second, interesting. देखो, nowadays there is a much more awareness, or the organizations like Icmr or all the organizations are creating awareness regarding this STS Success. So many students are going to apply. Earlier there was 4,000, 5,000 applications. Now it will be doubled. Okay, so through that, the selection will be of 1,500 students. So your topic must be interesting. It should catch the interest of the reviewer. Okay, so make it interesting. It should be novel. That is, confirm, refutes, or explain the previous findings. Okay, suppose that a general funda hai, that is, exercise is helpful for the your physical health or mental health. Okay, so either ये confirm करना चाहिए आपका डाटा और उसको कुछ तो extend करना चाहिए कि इससे ये benefit होता है. Exactly, if you are going in the another direction, that exercise से benefit नहीं होता है, इससे loss होता है. So ऐसे there should be a novelty. Okay, it should be ethical. Okay, because ethical approval certificate के बिना it is not going to accept it. Okay, so your institute review board will approve this. So the things should be ethical, okay, and it should be relevant to the scientific knowledge. It should be relevant to the health policy, and it should be relevant to the future research. Now, understand that we all are the medical students. So whenever we are thinking, we should be think in terms of the cause and effect. Okay. So through this final criteria, finalize your research topic. Okay, research question and prepare one good hypothesis. Okay. Now let's go towards the title. ओके, सो बहुत ज्यादा लोग इंडेक्स देखते हैं, जैसे बुक में हम इंडेक्स देखते हैं, वैसे ही यहाँ पे बहुत ज्यादा जो रिव्यूअर्स है वो टाइटल के ऊपर डिसाइड करते हैं. सो व्हाट यू आर गोइंग टू डू दैट इट शुड बी अप टू द 25 words, but make only one sentence. Don't merge 2-3 sentences. Okay, it should be simple but catchy. It should be short yet informative. The purpose should be explained. Okay, and effective टाइटल नॉट ओनली कैच द इंटरेस्ट बट ऑल्सो वही पे उसका डिसाइड होता है आगे पढ़े या ना पढ़े. ओके, सो यू शुड मेक इट इफेक्टिव. अब क्या क्या इंक्लूड होना चाहिए इसमें? सो देयर इज वन क्राइटेरिया, दैट इज पिकॉट क्राइटेरिया. ओके, सो इंक्लूड विच पॉपुलेशन यू आर गोइंग टू डू फॉर द स्टडी, व्हाट इंटरवेंशन यू आर गोइंग टू डू, whether you are going to compare the things, what is the outcome of your interest, that is what you are going to measure, improve, or see the effect. Okay, what is your time duration? Okay, so through this is a standard PICOT criteria. Don't afraid of these mnemonics. These are the very easy things. You can easily get the guidelines regarding this. Okay, so follow this PICOT criteria for preparing a title also and hypothesis also. Now यहाँ पे एक चीज देखना, that do not capitalize all the words. Okay, हम लोग क्या करते हैं, उसको अगर सजाना है हमें डॉक्यूमेंट को, तो उस बहाने हम लोग उसको पूरा कैपिटलाइज कर लेते हैं, और वी आर यूजिंग सम फ्रेजेस और लेसर नोन एब्रिविएशंस व्हिच ओनली यू एंड योर फ्रेंड नो. ओके, सो यूज स्टैंडर्ड एब्रिविएशंस इफ यू वांट, बट डोंट यूज दिस लेसर नोन एब्रिविएशन, अननेसेसरी फिलर वर्ड्स. ओके, एंड और द एंड. ओके, सो डोंट डू इट. Okay, do not make it lengthy. Though Icmr says that it is up to the 25 words, it is not required that there should be the 25 words only. So आप लिखते जा रहे हो. No. Okay, it should be up to the 25 words, but 15 to 20 words the title is also a standard title. So just take an example, that effectiveness of the hepatitis B treatment in the HIV infected adolescent, in the prevention of the liver disease, a cross-sectional study. तो इसमें treatment आ गई, disease आ गया, पॉपुलेशन कौन सा आ गया, आउटकम आ गया. ओके, सो इन दिस वे मेक अ इफेक्टिव टाइटल सो दैट कि आपके स्टडी में क्या करने जा रहे हो इट शुड बी क्लियर कट टू द ऑडियंस. ओके, अब आपने टॉपिक सिलेक्ट कर लिया, टाइटल हो गया. नाउ लेट्स मूव ऑन टू द इंट्रोडक्शन. इंट्रोडक्शन के लिए बिफोर राइटिंग टेक अ पेन एंड पेपर एंड जस्ट राइट दिस 5W. व्हाई, हु, व्हाट, वेयर, व्हेन. Why did you choose this topic? Write 2-3 words. क्यों choose किया? Okay, just don't say like this that guide ने ये topic दिया है, मेरा friend ये topic ले रहा है. Just think rationally as a medical student. Who are the information providers? What are the major questions of the topic? Where your topic is important? At the local level you are thinking, national level or international level. Are you doing the prospective study or retrospective study? So what is the time? Okay. And always remember, not only regarding the research, but also in the life also, then why is clear, then how is become very much easy. Okay, so in this way, think rationally, think in terms of the cause and effect. Okay, so keep it concise, to the point. Just try to make the 3 paragraphs. First paragraph, what is currently known, brief introduction. जैसे obesity पता है, obesity के stats दे दो. ठीक है. What is the study? What is the importance? Clearly state your research question, which has to be standardized as per the finer criteria. Okay. Now, in the second paragraph, explain all the things, including rationale of the work, experimental design. Now, experimental design में सारी methodology line 1 से लेके end तक नहीं लिखनी है. यहाँ पे you have to just enumerate the things that you are going to suppose that you are going to do the some sport test like the flexibility test. Okay, so enumerate it here. Explain the whole methodology in the methodology section. Okay, specify the gaps in the existing knowledge and controversy with the references. Okay, so आपको plus point भी बोलना है, minus point भी बोलना है, but it is not by your mind. Okay, कि आपको ऐसे लगा इसलिए. Whenever you are talking about the research or as a medico, you have to talk. ये book ये बोलता है, ये research ये बोलता है, ये research ये बोलता है, मेरा research ये कहता है. Okay, so in terms of cause and effect, in terms of this, you have to explain the things. And the last paragraph, which is most important, that tell the reader what this could be the bigger picture in the area of research. आज भले ही आप छोटे एरिया में ये रिसर्च कर रहे हो, बट इसका आगे जाके क्या फायदा हो सकता है. जैसे सपोज दैट आपने सपोज ये कोविड वैक्सीनेशन के ऊपर रिसर्च कर रहे हो, इसका बिगर पिक्चर डेफिनेटली आगे के टाइम में होगा. ओके, तो यू कैन थिंक दैट कि इसको हम लोग कैसे आगे यूटिलाइज कर सकते हैं. So what is the bigger picture in the research area? Okay, do not make the spelling and grammatical errors. Use the abbreviations and acronyms. Do not use this. Do not make the repetitions. Do not include the content which is not covered in the proposal. Okay, मतलब suppose that BP measurement आपके इंट्रोडक्शन आपकी मेथोडोलॉजी में है भी नहीं, एंड आपने एक पैराग्राफ उस पर डाल दिया 300 वर्ड्स करने के लिए. No, it is not acceptable. Okay, so include the things which are expected to do. Okay, so we have covered topic selection, title, introduction. Let's move on to the aims, objectives, and methodology. Okay, first thing, aims and objectives. These two are different things. Okay, aims is the short but general statement. Okay, and objectives are the specific statement that define the practical steps you will take to achieve your aim. मतलब, suppose that ICMR STS अवेयरनेस करने का ये एगम का प्रोजेक्ट है. ओके, तो एम है जनरल अवेयरनेस क्रिएट करना. ओके, ऑब्जेक्टिव्स कैन बी, यहाँ पे एक टॉपिक रजिस्ट्रेशन के ऊपर टॉक होने वाला है, यहाँ पे रिसर्च प्रपोजल के ऊपर टॉक होने वाला है, यहाँ पे स्टूडेंट्स के क्वेश्चंस टेकअप करने वाले हैं. सो दैट कैन बी द 1 1 2 3 4 ऑब्जेक्टिव्स. ओके, सो फर्स्ट consider that aims and objectives are the different things. Do not make the same thing into it. Okay, so writing the aims and objectives in terms of the whether these are specific, whether it is measurable, whether it is achievable, whether it is realistic, and whether it is time bound. Okay, so just follow the SMART goals. Why? Because ICMR STS you are going to do with your academic curriculum. Okay, ऐसा नहीं है कि आपको 6 महीने अलग से दिए जा रहे हैं. So along with your academic studies, you have to complete this project. So, और अभी ये आपका पहला प्रोजेक्ट है. So go with the specific things and time bound things. Okay, out of the box सोचना है, but it doesn't mean कि कोई unrealistic चीज आप प्लान करके रखो. Okay, उसको रियलिटी में भी आपको ही लाना है. So think in this way. Okay, pinpoint your major focus, break down your focus into the objectives. Be concise, keep your number of objectives limited. Okay, ऐसा नहीं कि 10-12 आपको करते जाने हैं. ठीक है, make it limited. Use the action verbs. I want this study, want to determine this. Okay, want to correlate in between these two things, want to compare in between these two things. और ये सब लिखने के बाद proofread and review your objective. Okay, coming towards the methodology, which is the, as sir also said, that it is the lengthier or descriptive portion. Okay, almost we have to write 800 or 60 to 80 sentences. अब लिखना क्या है इसमें, राइट? बहुत सारे क्वेरीज इसमें आ जाते हैं कि अब 800 वर्ड्स क्या लिखें. ओके, सो दीज आर द थिंग्स, पैरामीटर्स which already given by the ICMR, that type of study, study design, population, sample size, statistical tools, selection criteria, intervention, research instrument, data collection procedure, quality control, confidentiality, ethical consideration. अगर ये 11 points को आप elaborate करते हो तो easily you can cover the 800 words, and these are really important. let's see one by one. First type of study and design. Okay, so I know that just if there is a researcher assigned the exposure, then these are the experimental studies. And if researcher didn't assign any exposure to the sample, then these are the observational studies. And in that observational studies, if there is a comparison group, then these are the analytical studies, which can be the case control, cross-sectional, and cohort. Cohort, case control, and cross-sectional. Case control means retrospective study. Okay, आज की स्टेज में आप देख रहे हो बैक में कितने लोगों को ये डिसीज हुआ था. ओके, क्रॉस सेक्शनल मींस आज के स्टेज में कितने लोगों को ये डिसीज हुआ है और उसके इफेक्ट्स क्या है ये आप देख रहे हो. और कोहोर्ट मींस आज अगर अफेक्टेड है तो सपोज दैट आज स्मोकिंग कर रहे हैं तो लाइफ में उसको बाद में कब कौन सा डिसीज होने वाला है, ऐसे आप प्रोस्पेक्टिव स्टडीज में देख लेते हैं. ठीक है, so in this way you are going to do the analytical studies. If there are no comparison group, then these are the descriptive type of studies. Okay, as we already know, the experimental studies, actually clinical trials are not allowed. So most of the students, you are going to do the studies which are the observational studies. Okay, so here you have to just enumerate which type of study you are going to do. Okay, the subset of the target population from which the sample is actually selected. Like the target population, from this you are including the study population, and from this you are taking the sample size. Okay, the sample size, remember that this is not ready-made value. Okay, because I just remember that one student told me that मेरे batch में 100 है, so I will take the 100 sample size. Okay, so it is not a ready-made value. It have to be find out through the formula. I'm just giving one formula. It is the sample size is calculated from the prevalence. Okay, and the last that there are the different statistical tools that how to organize your data or analyze your data. So there for the comparison there are the different tests, for the correlation different tests, paired t-tests, ANOVA t-tests. If there are the 3 group softwares, SPSS or Microsoft Excel. Now I know that first year and the students who are passed and entered into the second year, these are confused about these all things. Okay, so don't get confused, don't get afraid. For the type of study, sample size, study population, statistical analysis method, you have the solution. Just go meet the guide, tell that you want to write something about your studies, and you have to include these all parameters. So definitely your guide will help you. The statistician, which is from the community medicine department, he can guide you. Still more in-depth knowledge can be given by you. Okay. Now, the faculty from the community medicine department also give the elaborate explanation on these 4 parameters. Still, you are not satisfied. You can see the softwares on the Google, like the past softwares or any different softwares on the Google, which can give you all these details. Okay. So in this way, you have to write about the methodology. Coming towards the selection criteria, which maintain the validity and homogeneity of the study. But too much inclusion, too much exclusion nahi karna hai. Okay? So there is one example that inclusion criteria for the COPD cases. So age is included, diagnosis of the COPD is included, then the spirometric test is included, then a history of the smoking is included, and is there any stable disease or no recent exaggerations? These are included. Now, what is the exclusion criteria? That diagnosis of any other respiratory disease or any acute or chronic condition that will limit the patient to participate in the study or refusal to give the informed consent. Okay. So proposed interventions, we have to mention कि क्या करने वाले हैं आप ना उनसे योगा कराने वाले हैं, उसका प्री टेस्ट पोस्ट टेस्ट इफेक्ट देखने वाले हैं, बीपी मेजर करने वाले हैं. So in this way you have to see this. Okay, research instrument, बीपी मेजर करने वाले हैं तो you are using the sphygmomanometer. हैंड ग्रिप टेस्ट करने वाले हो तो डायनामोमीटर. सो व्हिच इंस्ट्रूमेंट यू आर यूजिंग. नाउ अगर आप सर्वे करने वाले हो, आप बोलोगे मेरे पास कोई इंस्ट्रूमेंट है नहीं. नो, योर क्वेश्चनरी व्हिच इज अ स्टैंडर्ड और वैलिडेटेड, दैट इज योर रिसर्च इंस्ट्रूमेंट. ओके, सो यू हैव टू एक्सप्लेन दिस. ओके, अगर अभी बीपी इंस्ट्रूमेंट आपको लिखना है तो इट इज नॉट लाइक दैट कि आप लिखो सिर्फ स्फिग्मोमैनोमीटर. ओके, राइट, ऑटोमेटेड है या फिर मैनुअल है, उस इंस्ट्रूमेंट के बारे में आपको इंफॉर्मेशन. And this all information, there is always brochure with all the instruments. Okay, so you have to mention this. Data collection procedure. There are the 2 types of data. Okay, qualitative, quantitative data. Qualitative means जो आप मेजर नहीं कर सकते हो, क्वांटिटेटिव डेटा जो आप मेजर कर सकते हो, तो ये आप कैसे करने वाले हो? सिर्फ ऑब्जर्वेशन करके करने वाले हो? क्वेश्चनर बेस्ड है? क्या है, किस वे से आप डेटा कलेक्शन करने वाले हो? यू हैव टू मेंशन क्वालिटी कंट्रोल। अगर इंस्ट्रूमेंट है देन यू आर गोइंग फॉर द कैलिब्रेशन, क्वेश्चनर है वैलिडेशन करोगे उसका। नाउ वैलिडेशन इसके बारे में बहुत क्वेरीज आती है। तो देखो, अगर आप कोई भी क्वेश्चनर बनाते हो और अगर खुद बनाते हो, आपको कोई स्टैंडर्ड नहीं फॉलो करनी है, आपने खुद ने डिसाइड किया कि मुझे ये क्वेश्चनर बनानी है इस टॉपिक पे, ठीक है, तो आपने वो क्वेश्चनर बना दी, देन यू विल मीट द एक्सपर्ट ऑफ दैट फील्ड। अगर आपने एंजाइटी से रिलेटेड बनाई है तो आप साइकेट्रिस्ट के पास जाओगे, आपके कॉलेज के, उनसे वो वैलिडेट कराओगे और 3-4 आप स्टैंडर्ड लोगों को वो दोगे, सब्जेक्ट एक्सपर्ट्स को, ठीक है। एंड वो जो मॉडिफिकेशन है वो करने के बाद वो क्वेश्चनर आपके नाम की हो गई, दैट इज योर क्वेश्चनर, दैट द प्रोसीजर इज कॉल्ड एज वैलिडेशन, ओके। एंड अगर आप स्टैंडर्ड जैसे कि जैसे XYZ मिस्टर XYZ ने ऑलरेडी की है, वो वैसे की वैसे अगर आप क्वेश्चनर यूज कर रहे हो, तो वहां पे आपको आपकी उस बंदे की, और यू हैव टू गेट अ परमिशन फ्रॉम दैट पर्सन, ओके। कॉन्फिडेंशियलिटी आप कैसे मेंटेन करने वाले हो? एंड द लास्ट बट मोस्ट इंपॉर्टेंट पार्ट, दैट इज द इथिकल कंसिडरेशन, ओके, आपको मिलना चाहिए, ओके। नाउ हाउ विल यू गेट? हर इंस्टीट्यूट में एक इंस्टीट्यूशनल इथिकल कमिटी होती है, ठीक है, उसके फॉर्मेट्स एज पर द डिफरेंट कॉलेज अलग अलग होते हैं, सो यू हैव टू अप्लाई इट एंड गेट द ethical approval later, okay. Do not summarize or abbreviate the methods without giving full details, okay, because आपकी स्टडी का मतलब ये होता है कि कोई उस चीज को रेप्लिकेट करे और बाद में आप उस चीज के ऊपर एक्सपांड करें स्टडी, ओके। So do not presume that you will always remember all the things, okay. So write the methodology in detail, that will be helpful to all, okay. So in this way you have to explain the methodology in a 800 words. So if you follow these parameters, these are the very basic parameters, okay. So in this way we can cover up the methodology. And now we are coming towards the last part of the session, that is the implication, references and the plagiarism concept. Now implications, the research implications means you have to write it in up to the 100 words, that is what it will be gained, okay, or how the findings are important for the policy or practice or theory or subsequent research. There can be the short-term goals or the long-term implications, okay. So example that why we are in this session, short term can कि आपको थोड़ा सा पता चला कि रजिस्ट्रेशन की डेट ये है, हमें इस वे से रजिस्ट्रेशन करना है, अच्छा चलो तो रिसर्च प्रपोजल लिखना है तो इस पैरामीटर्स में लिखना है, दैट कैन बी द शॉर्ट टर्म implications, okay. लॉन्ग टर्म की आपने बहुत अच्छा प्रपोजल बना दिया, आपने रिसर्च सीख लिया, ओके, सो दिस कैन बी द लॉन्ग टर्म। इसके लिए आपको थोड़ा सा आपका ब्रॉड एरिया हॉरिजॉन बढ़ाना पड़ेगा थिंकिंग का, एंड देन इन दिस वे जस्ट थिंक इन अ ब्रॉडर इमेज कि आपके रिसर्च के लॉन्ग टर्म इफेक्ट्स क्या हो सकते हैं, एंड जस्ट नोट इट डाउन। द लास्ट पॉइंट दैट इज रेफरेंसेस। बहुत सारे स्टाइल्स है, एक स्टाइल है जो ICMR बोलता है, दैट इज वैंक्योर स्टाइल। बुक्स के लिए अलग है, आर्टिकल्स के लिए अलग है, वेबसाइट्स के लिए अलग है। मैंने यहाँ पे एक एग्जाम्पल दिया है, बट वैंक्योर स्टाइल के लिए आप ऑथर्स के नाम डालते हो, द टाइटल ऑफ द आर्टिकल लिखते हो, देन जर्नल का नाम लिखते हो, देन पब्लिकेशन के डेट डिटेल्स डालते हो, वॉल्यूम इशू नंबर डालते हो, एंड देन पेज नंबर मेंशन करते हो, एंड URL मेंशन करते हो। आई नो दिस कैन बी फॉर द फर्स्ट ईयर, इट इज ऑलवेज अ कंफ्यूजिंग थिंग, एंड फॉर द मेडिकोस यू मस्ट नो दैट these are the styles. Now how to get it? एक तो there are the online guidelines which you can download, that Vänkyr style referencing guidelines, okay. So in this way you can write it down. There are the different softwares which you can use, and the last important solution is the guide. Your guide can guide further for this, okay. One thing, अब आपने सब लिख लिया, अब आपको ये देखना है कि प्लैगियरिज्म है या नहीं। प्लैगियरिज्म मीन्स आपने जैसे के तैसे उसी चीज को कॉपी की है, दैट इज रिप्रेजेंटेशन ऑफ द अनदर ऑथर्स लैंग्वेज, थॉट, आइडियाज और एक्सप्रेशन इन एज अ वंस ओन आइडिया, ओके। तो ऐसे नहीं करना है आपको, तो आप मिनिमाइज करने के लिए राइट द थिंग्स इन योर ओन लैंग्वेज, okay. Own language means in English only, but you have to write it in your own sentences, you have to reframe it, okay. The guide can give you the institutional software access, or there are the Google plagiarism check softwares like Unicheck, Scribr or Grammarly, okay. So you can check it. Maximum 5 to 10% is acceptable, above 10% is not acceptable. in other platforms, Icmr do not give that percentage, but in general, you have to cover it up to the 5 to 10% only. Okay, that is acceptable level. Okay, so we have covered from the topic selection, title, introduction, aims, method, implications, references, and note on this plagiarism. So I wish you all the best, and thank you, Agam, once again for providing the opportunity. This will be definitely helpful for the student who have the query regarding the STS Icmr. Thank you, Agam. So with this, I will conclude this session. Thank you.
Sorry, my video is not being starting actually.
Okay.
Okay, thank you so much, ma'am. That was really, really a very detailed session. And I think it will be very useful for all the students out there, because these are things which most of the students don't get to learn from any single platform. So that was very useful. And even for me, it was a kind of good revision with, I got a lot of new things also from this now. Maybe it'll be useful for me in upcoming researches.
Thank you, Lagi. Thank you.
Yeah. Thank you so much, ma'am. Yeah. Now I'd like to call Shreyas to share his experience on his research, which he did in 2020 Icmr STS South.
Thank you, Mrutulagi. First of all, thank you so much, ma'am. It was a really wonderful session. I truly learned a lot of things. Like I would have inculcated in my proposal and synopsis, it would have made it better, more better than which I presented or prepared. So thank you so much, ma'am, for that wonderful presentation and wonderful drive too.
Welcome.
So yeah, coming on to how what was my experience with the Icmr STS 2020 proposal and report writing. So basically, I applied for Icmr in my second year. I also applied it in my first year, but the proposal was not selected. And in second year, I applied for the same. Due to COVID, the extension was there in the results. The results were delayed, and the results when came, my proposal was selected, fortunately. And then I conducted the report after coming back to my college. I conducted the data analysis part after coming back to my college. So my topic, it was related to the pharmacology. I was assessing the adverse drug reactions which were observed in the patients of antiretroviral therapy who were taking the antiretroviral therapy. And my part was to just deal with the early 6 months onset of adverse drug reaction. So why did I choose this topic? Basically, you guys know that pharmacology is something which is dealing with the cure of the disease. And AIDS here is not curable. We are just testing that this drug can be applied on this drug can be applied on this, and we are not having 100% accurate cure of it. So the researches are going on and everything is going on, but though we have not got any vaccine or any 100% cure of it. Recently also, NACO has changed the drug regime of the AIDS in the year of 2020, which they were using previously like TLD and TLE. So they have changed it. So yeah, still there are changes which is coming up. And as the AIDS is something which is also welcoming the opportunistic infections because the patient immunity is decreasing. So because of that, the patient has to take many drugs. So compliance here decreases when we ask the patient to take this drug continuously for a year and for the lifelong. So because of that, here the adverse drug reaction reporting becomes very important because this can decrease the compliance. And if this decreases the compliance, the burden of AIDS on this planet would also decrease. Why? The resistance would increase. And as we are not having cure, then we have to cure this resistance. Like you guys know, Mycobacterium tuberculosis. We are increasing there is increase in resistance patterns of it, and we have to make another drugs to cure it. So to decrease this burden, we have to make sure that enough research is being conducted in this field. That is why that's something which diverted my mind to choose this topic. And yeah, I will go ahead with it. And I literally learned a lot while carrying out my research. My research was something which was done by interrogation of the patients. I interrogated with patients after taking consent. free consent. And then I asked them like what were the adverse drug reaction which observed during the treatment. If they observed, they were noted it down, and I particularly interrogated around 431 patients in the period of 2.5 months, considering my exams and all those stuff. So it took around 70 days to complete my this data collection. Then I further done this report and made the report and submitted the report in November 2020 to the November 2021 to the Icmr. So that was something I literally learned a lot when carrying out research, like how to deal with the patient, what is the importance of rapport building, like patient is in pain, so how to make sure the patient don't feel the pain, and also be polite with the patients, because AIDS patients are something which are literally stigmatized. And I literally got very new things, like increased serum creatinine was something which was not reported to pharmacovigilance program of India. And other than that, many things like I observed the rare thing, that is the child was inborn sensitive, not sensitive to the drug, that is abacavir. So we find it out with the gene typing. So this is something which were new findings, and I literally enjoyed doing the research. So I would also motivate you to take this as an opportunity, because Icmr provides this opportunity for undergraduates so that they can invest their career. If they want to go in research, so they can move ahead in this research field. Other than that, this is also a promo or just an overview, like how you would be writing the thesis in the PG. So you would be also getting acquainted with it. And other than that, as you would be doing clinical research or paraclinical, you would be building a good rapport with your teachers also, and how to deal with patients. And other than that, if you are doing any laboratory study, you will learn how to conduct the test, and many different things you will learn in the course of time. Time management, that is the most important thing. I submitted my research on the last date, I remember, because the research is something, at the last time also, I was just going through my proposal and seeing like I am not missing any point, like when Costal is there, these are my references. I was cross-checking with the introduction that I've taken this point from this article, so that is perfect, and all those stuff, arranging it in the sequential manner. So yeah, it takes a lot of time, but it is worth. So that was it from my side regarding my STS journey. I further hand it over to Atul to carry forward and share his journey of Icmr STS 2019.
Thank you, Shreyas. So yeah, so that would have created an interesting experience among the students. So yeah, that would have created a motivation among the students to face the different kind of experiences that you would have come across. So my story, I did my research in second year. So that was the very first time I came to know about Icmr STS through one of our faculties in our college. So it was like an announcement in our community medicine department, as well as in the pharmacology department. They announced that there is something called Icmr STS, and it's all about the research. So when I heard this word research, I got this curiosity to know what it is and how we actually do research in the practical field. Because during school days, all that we know is research is a high-five area where there'll be scientists and all those kind of stuff. So I had that curiosity, and I wanted to know what exactly is running in research, especially in the medical field. So with that curiosity, I went to the faculty who told us about this research. He was from the Department of Community Medicine. So I went, and the topic selection was the initial process. So for me, it was like they gave me an open-ended choice to choose anything, whatever that comes to my mind. And I think basically that is one very important thing to make us get connected to research, because when sometimes it becomes like systematic, and I have heard in some colleges that guide specifically allots a particular topic to a student, and the student takes up the topic and does that. But instead, if they give you that open choice, it will induce the curiosity in you, and it will help you find yourself what is more interesting for you. So that will also give you a direction as to show your interest in a particular field. So it was like that for me, fortunately. So our guys, what they did was they just told us to bring a list of topics, whichever you feel like you're curious to learn. So I, at that point of time, was getting into the clinics in the very beginning. So I saw a lot of patients. We don't even know that these are the long case, short case, for example. It was that period when you're a little kid getting into a clinic, just seeing everything with that fascination. So to me, that point of time, I found interesting about this CAD and CVA, so which were the most common diseases which we used to see in the wards of medicine. So when I used to think about that, all that which comes to my mind is, why do these many people keep getting admitted, and why is it that they get ended up in a completely debilitating disease? Like they cannot recover completely back to normal. So that was one nagging thing which was in my mind at that time. So I talked about this to my guides, and they took the point, and they showed me the path where I can actually work on this. So they gave me an insight about choosing about the health seeking behavior. I did not know about this fancy term at that time, but what exactly was a question in my mind was about this health seeking behavior. So they told me to choose this area to study, and then the refining process started. So that's how my topic got finalized. And mine was a cross-sectional study in a tertiary care center. So that was about the health-seeking behavior among the coronary artery disease and the cerebrovascular accident patients. So that was how the topic was chosen, and the process just began. So it is given to be like 2 months for the project completion. And once you begin into this process, even from the stage of topic selection, there will be a lot of hardships which you'll be facing. So as I would like to tell my past self, that is my younger self, which would have heard few points which would have given more confidence, there are a few things. I'll just tell about that in a very short way. So there are just three things that I feel like telling you now. First thing, whenever I think about research now, all that comes to my mind is curiosity and persistence. So without these, we cannot definitely get through research and complete that. So that is always there in my mind. And the thing is, when it comes like a commitment that you need to complete this research for the purpose of this thing, or maybe for adding to your CV, it becomes a systematic thing, and it's a kind of compulsion. But research, actually, it's something very similar to how you're choosing MBBS. Without interest, just because if you choose, it's going to be, yeah, you're going to complete it somehow, but at times it will be very nagging, very stressful for us. But if you have that curiosity and if you have that persistence in you, you will definitely complete it. Because that was one experience I had seen among my friends, in my around the colleagues as well. So many a times when people feel like they do the research, they start it, but somewhere they'll feel themselves lost and they'll stop continuing the process. So persistence is extremely essential. And the second thing is, you need to develop some confidence, but this is not possible in the very beginning. So you need to learn about some basic stuffs about research, which ma'am has very clearly explained to all of you. So, and one more thing, this is not something you can learn in a day. So you will have to revisit what ma'am has told you, and that is going to give a strong foundation about what exactly research is, like the theoretical part of research. So you have different study designs, and you must know about those things. It's a very basic thing, but you do not find a perfect source for them. So that has been presented by ma'am, and it will be very useful for you. So once you get that clear in your mind, you will develop a confidence in you that, okay, so this is how research should be proceeded. And you will learn to choose what kind of research type fits for a particular research. So that is the point where you develop confidence. And the third thing is, always in research, whatever research you do, whatever duration we take to complete the research, there will be points when you feel like completely lost. And we will feel that sense of, okay, so what am I doing right now? Will this get completed? So it will put you to that base point where you will have no confidence at all. You will have so confused. So there will be definitely points, even if you are a very strong person in research, even if you're doing it for maybe 100th time, even at that stage, we will sometimes feel the sensation of being lost. So I would suggest to develop a circle of well-wishers around you all the time, because they are the people who are going to keep motivating you while you're doing this research. No, like sometimes it can be your guides, sometimes your friends or your parents. And sometimes, people who have been it could have been your seniors also who had completed these kind of researches before. So they will be there as a back for you, continuously motivating you. So one might be available one time, another might not be available. Like sometimes your guide might be busy, so you will have to rely on some other person. Sometimes your seniors might be busy, so you will have to depend on some other person. So it will be a process where you will definitely need a support. So develop that support system and make sure that you're always making yourself safe in the process of going into the research. So that's another point. And conclusively, I actually take this point to thank my guides because they had been really, really helpful because me, not from a medical background, I don't have any insight about what research is, not even about the medical field as such. So when it is literally like a kid getting taught by the teacher the ABCDs in a language. So it is definitely possible only by a guide because you get a personal mentor who gets to know about you and you can ask any number of doubts to the person. So that is one very important thing because you need to choose the right guide who's compatible for you. So that's essential. And my guides were Dr. Kokila ma'am and Dr. Damodaran sir from the community medicine department of our college. They had been continuously supporting. And at times you will get situations when you will be again missing yourself somewhere. Even your guides might not be available, but the points that they teach, that will help you through the process. And yes, so I think these are the most important things I wanted to share. And last but not least, there are some benefits that you will get while you're doing this research, which can be your personal motivation. Like anytime you're going to do a research in future. So if you are doing a post graduation, you're definitely going to do a research. But somehow, if you are in the medical field, you will be in a point where you will be made by the system to do a research. So that will be a compulsive point. So instead of getting locked up that point, you can use this opportunity to learn about research in a fun way right at the undergraduation. So that will be one biggest advantage that you can get. So that will add up to your confidence during your, higher classes, like after you go to higher stages. And then this in your quality, it will improve things like endurance, your time management skills. So it will teach you a lot of such things, not just like, theoretical things. It just makes you feel. So you can get to gain all those kind of things. And indeed, it will give you a confidence that you can do something new anytime in your life. So I think those are the things I wanted to share with you all. So yeah, so we'll also have an interactive session tomorrow in Instagram. So you can also ask us about the doubts that you have. And even in the comment box here, you can add your doubts, whichever you want to get clarified from ma'am and sir. So yes, over to Shreyas.
Yeah, thank you so much, Mritulagi. Very well put. I totally agree with it. And I also got motivated by this. So thank you so much for that. I would also like to add on that my guide was also so supportive, Dr. Sandeep Adwal sir from Pharmacology Department of Zydus Medical College. Other than that, Atul sir and Charushila ma'am has always motivated me. They were the part of Zydus Medical College and Hospital House. So I was so lucky that they always motivated me to carry out research. Like I remember when our first STS proposal was, the results were declared, we were on the way to Bhavnagar quiz and I was with Charushila ma'am. So they have really been a great motivation to me in terms of research or in terms of academic or in terms of any help. They are so friendly and so best teachers. So thank you so much, ma'am and sir.
Zydus is always in our hearts, and Zydus students are always become part of our life now. Yes.
Yes,
but to be very frank, this is a very nice platform you guys have created, and through this organization, you have taken this very nice initiative. So, would like to say that keep it up. We all best wishes are with you.
Thank you so much, ma'am. That means a lot to us. So, yeah, that brings us to an beautiful end of this session with Atul sir, Charushila ma'am, and Mritulagi. So, yeah, tomorrow we would be having, as this live session won't be watched by everyone on YouTube, so they won't be able to write down their queries over there. So because of that, we thought to have an Instagram live session, which would be totally based on what are your questions. Like we would be answering your question and answer along with ma'am and sir. So that would only cover question and answer. So tomorrow at 6:30 p.m. we would be having Instagram live session. So if you are having any doubts, just tune into Agam Instagram ID, and we would be live at 6:30 and clearing all your queries. If you are having any more queries, you can put it down in the comment section, and that can also be addressed by ma'am and sir. You will be reaching out to them. So worry not, your all queries will be addressed. This is your last opportunity, like 11th February, we are having last date of registration. So if you are registering, then only you would be able to submit the proposal. So give your best. We have tried our best from our side. We will try our best to make sure also your queries are answered, but also give your best, and we wish you all the best for the same. Now coming on to vote of thanks for the day. So Mritulagi, would you proceed further?
Yeah, sure. So yes, this event has come to a good ending now, and I must thank the speakers, because actually it was from their spark that this event was made possible now, because it is indeed a tough time for, we all are right now into our exams currently because of all those COVID and stuff like that. So despite that, it was the spark which started from ma'am, which Shreyas used to tell. Charushila ma'am is very, very interested to share her knowledge to the people, not just in her college, and that's the most important part. So we were like, okay, so maybe this is one chance we can do, because when we initiate on our own, we need to go step in, ask people who can come forward and talk about those things. So I must thank Charushila ma'am and Atul sir for joining us today, and very, very patiently explaining everything to all the students here. And I must thank Shreyas as well, because it was he who was coordinating everything with ma'am and sir, and it was he who brought them to the stage. So must thank him for the work that he has put into this event. And of course, all the people who are right now working in the background, organizing this thing. It is the gratitude extends to them too. So thank you so much, everyone. And I hope this session would have definitely been helpful for all the students. But there will always be something that will be popping up in your mind to clear something, like some doubts will be arising in your mind. So if you have those questions and queries, you can definitely ask it in this comment session. And in that section, you can add your questions, because you're always welcome. And the one thing is, the date is getting closed, as Shreyas mentioned. It is by 11th that the registration ends. And but you have time till 21st to complete your proposals. So while doing the process of proposal, like preparation part, when you do it on your own, that's when you get a lot of doubts. So even if you have doubts at that point, you're always welcome to put forward your questions, and we are there to help you as best as we can. So thank you so much. And I think we can. Thank you, sir. So I think we can end the session here.
Yeah, thank you so much, sir.
Thank you, Shreyas.
It was so lovely to have you here.
Thank you, sir. Thank you, ma'am.
Thank you.
Thank you, dear. Okay.
Thank you, ma'am.
Ma'am and sir, we can have a photo, group photo.
Sure.
Ramakrishna, you can also turn on your video now. Ramakrishna?
No, it's all right. I think he would have gone somewhere.
Okay, no worries. So we will have a photo.
Yeah.
I have taken.
Okay.
Okay, dear. Thank you
so much.
Thank you
so much, everyone.
Take care.
Okay.
Bye-bye.
Thank you, dear. Should I leave now?
Thank you so much.
Okay. Thank you, dear.
See you tomorrow, ma'am and sir. Mritulagi, ma'am.
Yes. Is Ram there available? Yeah, everything was perfect. And